all. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So, the discussion today I think is really important. And thanks to a doctor friend who sent this article over to me, then I looked at the study. And here is the basic summary of the study. In this study, what they're saying is that vaccine can cause tinnitus. I believe that SARS-CoV-2 can cause tinnitus as well. Secondly, they're saying that at least in this case report, this is a one person's case. This one person did not respond to the standard therapy for tinnitus. And then what they did was they tried this alternate therapy of repeated transcranial, that is from outside the head to inside, or the electromagnetic field, transcranial magnetic stimulation of the brain. And that almost brought the person's tinnitus down to grade 1 or non-handicapping. So let's look at this. This is fascinating study, and this is a great hope as well. I hope it actually works out for others too, but this is worth a try. And again, this is not a medical advice. This is a case report that I'm going to discuss with you. So this is drbeen.com. If you like these lectures, there is a link in the description, which is 1,000 Dr. Bean lectures, premium lectures, for a price, one-time price of lesser than $100. I think you would enjoy that. So with this, today in our discussion, our anatomy friend will join as well. This is something that is called Tinnitus Handicap Inventory. Here, the patients can assess that how badly tinnitus is impacting them. So if you see down here in the bottom right corner, if the score is between 0 to 16, then it is grade 1. That means it is not disabling. Then as it starts going above 16, it starts becoming various grades of disabling the person or handicapping the person. So for our discussion, at least please keep in mind, lesser than 16 will be more of a non-handicapping grade 1. And above that will start becoming an issue. Then this is the journal in which the study or the case report is presented, Oxford Academic QJM. And this is the study itself. The study is, or case report is, from Taiwan. This is a bunch of audiometry charts that they have done, and we will discuss them. This is the description of transcranial magnetic stimulation, and this is some more references for us to have. All right, so now let's start. So it is a case report, and so we'll look at the summary. So this is one, if you just wanted a summary that what really happened, here is what happened. There was a patient. It's a female, I believe, 37 years of age. She received Pfizer-BionTech vaccine. She used to have tinnitus before as well. However, after the vaccine, it became really bad. The doctors thought this is immune mediated, which they thought correctly. They thought it is immune mediated. Cochlear damage. Cochlea is the part in the temporal bone, the bone in the where the internal ear is present, or the ear structures are present. So they thought this is cochleopathy because of the immune dysregulation or immune attack. They did what is normally done in this case, immune dysregulation, and that is to give steroids. So they gave dexamethasone and they gave prednisolone. But the patient did not recover. So then they tried repeated transcranial magnetic stimulation for many days, one session per day and for many days, and the patient almost recovered. So that is the story. Now we're going to go into what is the takeaway. So if you just wanted to break here and say, all right, 5 minutes later, what do I do? This is an interesting therapy for those patients whose tinnitus is not responding to standard therapies. So this is interesting to speak with your ENT doctors. So here is the case report. Couple of things in the case report that I'm not fully on board with the authors. However, I also understand that nowadays, when a scientific study needs to be present in a paper, somehow the authors have to concede that vaccines are important and they're beneficial. Only then they are able to actually talk about there may be a side effect and how to manage it. I think that is just the way the environment is, the circumstances are nowadays. So authors say that tinnitus, because of the vaccine, is not a severe adverse effect. And I beg to differ with them because there are patients of tinnitus who are disabled, and there are patients who could even commit suicide because of this. Authors also say in their conclusion that tinnitus is a minor and reversible side effect of the vaccines, which is also incorrect. So if I go to their study and go to the conclusion of it, if you read here in the last sentence, they say, finally, in consideration of benefit and this minor and reversible adverse event, we still strongly recommend the continuation of the administration of Pfizer-BionTech COVID-19 vaccine. They could have left this sentence out as well and just presented their case and their report. However, I think, as I said before, it is important sometimes for researchers to get published. So they called it minor and reversible adverse event. I do not agree with that. So with this one disagreement, let's continue. So this case report is a woman. She was 37 years of age. She had a history of bilateral, that is on both sides, both sides, ovarian chocolate cysts as well. So she had that. Plus, she had bilateral tinnitus as well. So in 2020, so the way I have done this case report, on this side is the timeline, and on this side are the events. In 2020, she developed bilateral tinnitus. That means tinnitus in both ears. February 2021. February. So this story is going to go from Feb 2021 till March 2022. So more than a year, 13 months. So Feb 2021, she had this tinnitus. So she came over to these doctors and she said, I have this tinnitus. What they did was they ran this test, and then the number, the tinnitus handicap inventory grade came back to be 92. So if you look at this number here, 92, 78 to 100 is catastrophic handicap, grade 5. So that's the maximum handicap that a patient can have, or in the maximum range. So 92. So that means she was suffering really bad. This is before the vaccine. So what they did was they did a high resolution CT scan of her head. And if I can very quickly show you what they were looking at. So here, this, I have removed some parts of it. If I can put the, let's say, brain back in this system. So here is the brain inside the skull. And what we are interested in seeing are two things today. Number one, this part of the brain, this is called medial gyrus or anterior medial gyrus, or sorry, this is the superior frontal gyrus. Let me go to median. This is the one. So this is the left middle frontal gyrus. A part of this part of the brain is the one that they targeted for the therapy, magnetic therapy. The bone that we are interested in, where the cochlea is or the internal ear is, that bone is this bone, the temporal bone. Temporal bone, as you can see here, this is the structure of the bone. This is actually the bony canal for the ear canal. And inside here, if I can, this part, this raised part over here, this part inside it has cochlea. And of course, the vestibular, the whole internal ear structure is here. Middle ear structure is here as well. So this is where what we're talking about. And they're saying that this patient is going to develop inflammation of this bone and the structures inside, which contains the ear. And that is how tinnitus develops. So going back to this discussion here. So they did a high resolution CT scan of this patient on 26 February 2021. And they found that both temporal bones, both sides of bones where the ear structures are present or in which the ear structures are present, these bones were inflamed. So that was kind of their clue that why the tinnitus is occurring. On 22nd March 2021, they did a baseline pure tone audiometry. So audiometry is a it is a test where they would look at various frequencies of the ear and the ear's response to those frequencies. How this works is something like this. On the left side, on this y-axis, are the decibels, various decibels. Decibel is the volume of the sound. And on the right axis, or the x-axis, I'm saying right axis, x-axis is the frequency that we hear or we can hear. Now what they do is they play sounds at various frequencies that our ear should hear, but they play the sound at the very basic beginning threshold of that frequency. So let's say if the frequency is 12,000 or 12K, what they'll do is they'll play, let's say, 2 decibel volume, very tiny whisper like volume, and they'll see if you can hear it. And then if you cannot hear it, or the patient, they'll increase that to 5 decibel and 10 decibel and 20 decibel. And from there, they would try to figure out the ear's health, that how loud does a frequency have to be for us to register that as we can listen to it or we can hear it. So if somebody is responding to these frequencies within 0 to 2 or 4 5 decibel, they would say, well, this is within the normal range. Not 0 decibel, but meaning in the lower ranges. But if somebody cannot hear them, even let's say 20, 30, 40, 50 decibel, what that means is that a normal volume has to be brought up by 50 decibel for this person to register that frequency. So that is a hearing loss. So what they did was they did a hearing loss test as well. And what they found was that on both sides in this woman, there was sensory neural, that is sensory and neural, that means, so ear is a sensory system, right? So there was sensory neural loss on both sides. And there was, on the right side, it was mild. On the left side, it was mild to moderate. And the loss was in the extreme high tones. What does that mean? As I said, that they were looking at various frequencies. So if I can open up their chart here. So here, if you look at this chart, on the chart A and the standard audiogram, on the left side are various volumes that are necessary to register that frequency. And on the x-axis are various frequencies. So if you see here, a standard chart is that the person can hear the sound on that frequency within 0 to 10, 11, 12 decibels. And here, the blue cross versus the left. Blue cross means left ear, and the rounded thing means right ear. So this is a normal audiogram. But if you see here, this was this patient's audiogram before the vaccine. And if you see in the higher frequency areas, she was not able to hear correctly at lower volumes. That means she had hearing loss. So going back here. So what have we established so far? In 2020, she had the tinnitus. 2020, and normally there are some tinnituses that are temporary and can be resolved. Most of the time, if a tinnitus doesn't have accompanying hearing loss, usually it is said to be milder and can resolve. When the hearing loss starts occurring as well, then there is a bigger problem. But as you will see here, this woman had tinnitus with hearing loss, and she even then was responding to the therapy. So back here, March, they did the audiometry. They found that there was hearing loss as well. So what have they found so far? They have found that her bones were inflamed where the ear structures are, plus she had hearing loss, plus she had tinnitus. Plus the tinnitus was so bad that it was in the highest grade of handicap inventory. In mid-May of 2021, so she came to the clinic in February. So February, March, April, May. In mid-May, the doctors started her on ceftriaxone, 1 gram per week. That started giving her improvement. And look at this. Her handicap index came down to 12, which is grade 1, almost no disability. You can function with this. I think I may be in that kind of a level as well. Maybe I'm 3, 4, 5, 6, meaning I have tinnitus. It doesn't really bother me. I work fine. So 27th September, our tinnitus handicap index had come down to 12 just by the usage of ceftriaxone. Now, 23rd October 2021, she decided to get vaccinated and she got Pfizer-BionTech dose 1. On 26th November, she got the dose 2. And immediately after the dose, there was no discomfort, no problem. However, this is 26th November. By 29th to 30th November, within 3 to 4 days, she developed extreme tinnitus again. So, of course, that would mean she may have developed the cochleopathy or temporal bone inflammation, which now the question was it immune related? So let's see now. So now she's gotten the vaccine and her tinnitus has gone back up to the grade 5, disabling, very disabling. So tinnitus in inventory went to, the index went to 96. So, of course, she came back to the doctors on 1st December, and they found that she had bilateral worsening of hearing threshold as well. So, if you see here, this diagram B, in here, what are they really showing? In the diagram A, in the high frequency areas, frequency 1.2 and 16, these two columns, she was at, let's say, 50. So the volume in decibels had to be 50 for her to register that as, hey, I can hear this. And here on the B side, the volume had to be somewhere like 60. And the authors say that 10 to 20 decibel further increase in volume. So it may be in some cases even 70. So volume from 50 had to be now 60 or 70 decibels for her to register that as a whisper in that frequency or a lower sound in that frequency. So that was hearing loss as well. There is a good news in this whole thing. This patient has hearing loss, or audiometry is showing hearing loss. Tinnitus is showing grade 5 handicap. Even then, with the therapy, she recovers almost to full extent. That is an important news here. So 1st December, develops bilateral worsening hearing. So this is 4 days after, 5 days after. And the threshold in decibels changes by 10 to 20 decibels for the frequency ranges of 11.2 thousand, 11.2K to 16K. And especially her right ear was more affected. So they thought, the doctors, they said, well, she has cochleopathy. Once again, they thought her temporal bone had become inflamed. This bone, this bone had become inflamed, and inside the bone is the cochlea, and the cochleopathy is occurring. So, what did they decide to do? Normally, what we decide to do, the doctors, that hey, if there is inflammation and there is an attack of inflammation, let's start with steroids. So, they started her with steroids. So, one, they gave her IV dexamethasone 10 milligram stat. This is now December, late December. Then they started her on 5 milligram thrice a day. So that means about 15 milligram prednisolone. And they gave her that course for 3 days. And her improvement was not really great. And I think that this course may have been not the entirely covering course, but they say that this is their protocol for cochleopathy. And of course, they're ENT doctors, they know more than I do. So this is what their protocol was. However, the response was the protocol did not make much difference. So she went from, if you see here, the tinnitus handicap index of 96 to 88. So not much improvement, minimal improvement. Now she stayed in this state from vaccine third day after the second dose, that is November 29, 30. December is past, January is past, February arrives. And why am I counting the months? To convey this message that even if a lot of time is passed, that doesn't mean permanent damage has occurred. So we should continue to seek help, and our doctors should continue to figure out ways to help us. So February 2022, they started this alternate therapy because steroids had failed. So this therapy was repeated transcranial magnetic stimulation. In this, what they do is, I actually have a Wikipedia article open over here. So again, courtesy of Wikipedia, what they do is, I hoped I could make it bigger, but I guess not. So what they do is that there is a little wand that they have in their hand. Within that wand, there are two magnetic, um, electromagnetic rings, and as the current passes through them, and an electromagnetic field is created. That field then affects the brain's electrical field, and that is the impact that is created, and they create uh, 10 hertz, for example. In this case, 10 hertz. 10 hertz means the wave pattern of 10 hertz, and they gave such stimulations 3,000 times each day. That is what they did. So this is again outside of the brain. Actually, there was a beautiful picture here near. Look at this. So this is the magnetic coil. The strength of this coil is very similar to MRI, but this is outside the brain, and this also seems to be the uh, uh, frontal cortex. So back here, they started 10 hertz, 10 hertz repeated TMS, 3,000 pulses per day for some days. There was one session per day. So that these 3,000 pulses were given in one session. They gave 3 sessions. They started this on 16th February 2022, this year, 16th February. By 22nd February, so 6 days later, her THI number had gone down to 66 from 88. And by 9th March, that was another, so in February 22nd, I don't know, 28 days, let's say, so another 6 days plus another 9 days. So 15 days later, her THI went down to 6, which is in grade 1, almost good. Her THI in the beginning was higher than this. And the other thing that was very interesting, I saw in her graph, and I'll show it to you, her PTA audiometry improved better than what was her baseline before the vaccine. So look at this. That means if she had been given this therapy even before the vaccines for her previous sensory loss, it may have worked. So look at this. Before the So this is her baseline. 50 in this frequency range and 50 in this frequency range, decibels, right? That the volume has to be set 50 decibels for her to register that, let's say, as 0 decibel. And if you see here, this is C. This is after she got the RTMS therapy. And now the 11 to 12,000 range has 45 decibel and the 16,000 range has 40 decibel, and she over here baseline was 50. So not only this therapy was able to help her against the tinnitus or the immune inflammation by the vaccine, but even helped so much reducing the inflammation that even improved her beyond the baseline. That was very interesting. Now, this is it. The question now, what is their conclusion? Conclusion that, hey, we improved this one person. Great. This is a huge deal. Tinnitus can drive a person to suicide. Important thing they said was, they said we thought, and we had this studies in animals, that this transcranial magnetic stimulation can help with the inflammation of the brain. Now, how does it help with the inflammation? They don't have a mechanism. So maybe that magnetic field, now I am putting some conjecture out and it may be totally stupid, that maybe it helps with the blood flow, maybe it helps separate out the antibodies from the cells they are binding to, maybe it improves the blood circulation, whatever it is. What is interesting is that the RTMS therapy is, in this case, for example, plus in the previous animal studies, have shown to be anti-inflammatory for the brain tissue. And as you can tell from this case report, anti-inflammatory where the steroids were not working correctly, that is where this was helping. So I want to read this one part to you, and that would be the last part of our discussion. So if you look here, this green, let me see if I can increase the size, and then I can find it. Therefore, this would support the findings of significant response of tinnitus to RTMS in this case. We aimed to provide a point of view that effect of anti-inflammation by the RTMS might be considered to be an alternative choice in COVID-19 vaccine associated tinnitus. So that's a very interesting. And here they're saying, although the mechanism of the COVID-19 vaccine associated tinnitus has not been well established, the immune mediated inflammation might play an important role in this situation. So that is a discussion. For me, this was interesting, and thanks to Dr. Tommy for sending it over. I have actually forwarded this to Sean because you know that Sean has been struggling and fighting tinnitus. I sent it to Michelle as well, and I sent it to a couple of other folks who were fighting with struggling with tinnitus. So this is interesting. Do me a favor. Please like, subscribe, and share. There are links in the description. If you would like to support this work, you can buy the Drbeen 1000 videos at a very low cost, or you can get me a coffee if you like, or you can use PayPal, or you can become a Substack member or a patron. At the same time, if you don't want to do any of that, in the description of this video, there is a link to this study. You can take that link and share that with your friends and families. Thank you very much. And I would see you on the Cool Beans Cafe in a few minutes. And we'll continue with that chit chat.